Hi, Paul. It's Paul here.
Hi, Paul. Paul here. How are you?
I'm all right. Thank you very much. So we've prepared ourselves some questions, haven't we, for today?
We have, yeah.
We have indeed. It was so the first question that I'm going to pose us is as follows: what brought you to research / this research project? Would you like to go first, Paul?
Yeah, so I've been a researcher, as you know, Paul, but this is for our esteemed audience, isn't it? So I've been a researcher for a long time, about 20 years actually in Manchester. I'm older than I look, Paul. So, and I was a social worker before that. So my research kind of experience and interest comes from social work and care work. And I've been researching that and in older people's and mental health services for quite a number of years. But this particular project is about something that I'm really interested in, which is data and how we use data, but we're in social care for this project. So it's how particularly people that are responsible for social care, which is in England, in the UK, it's local authorities that sort of run social care. And it's about how they can use data that they hold. I was going to say about people, but that's a little bit of a negative phrase, but data that they hold about people using their services, or really more positively, I think, data they hold and they hold for people. Use their services, how it can be used in more creative ways to help them to kind of predict what might happen to them and how to increase their well-being and how they use services a little bit more profitably to help them live their lives in the way that they want, which is the whole point of social care.
And what do you think? There's like a misinformation at the moment in that. Do you think people understand that at the moment about their data? And
I think some people that use social care perhaps don't understand that, first of all, data is held about them, even though that's gone through with them in assessments that take place, for example. But also there's a bit of a kind of disjoint, I suppose, between their experience of themselves and the services that they receive and the data that's held about them is a little bit of a sort of arm's length event, but it can be used quite profitably to help both the local authority, which is why they collect the data about people, but also by the people themselves to help them manage their own care and work with, their social worker or local authority representative a little bit more in a sort of partnership. So this project's all about that. And how I came through to Made by Mortals and yourself was looking at that data process and just trying to make it a little bit more, come to life for people to appreciate that people might not know that this data is collected. And they might be even more, non-confident or non-knowledgeable about how it could be used in a positive way, rather than, we just collect this data about you to plan your care, etc. And it's all a bit, sort of
not a negative perceptions
at a low level. It's not used in a more innovative, practical way to help people. And that's what this project's about. It's about data analysis, but it's about keying into the people that the data concerns, I think.
Yeah, and helping them, because I guess, there's a negative perception around data collection at the moment for understandable reasons. And then also, I guess, I think, I don't want to, it could be a bit of a dry thing for people to sort of engage with. So,
yeah.
I guess with me, with the research thing, we kind of fell into it a little bit. Myself and Andy, who run Made by Mortals, we've been making participatory theatre and music for 10, 15 years, and for the cultural organizations we work for during that time as in a freelance capacity, we often got a bit frustrated in terms of, you went in, you did a project with a group of people using their lived experience, their skills, their imaginations, and you build people up to be involved in it. You'd perform it once, everyone would round of applause, and that would be it. I guess that started to get a bit frustrating after a while. and we felt that participatory work and practice wasn't being valued in the way that we thought it could be, and wasn't being used in society in the way that we thought that it could be. And you get to a certain age, Paul, and you kind of have to put your money where your mouth is, don't you? And that's why we formed Made by Mortals, with the aim of, being able to create work with communities that really could make a difference. And that's our starting point. And, talking to people like yourself, Paul, about that, and how that then could connect to PPI and PPIE and the research process, and how we could use some of those sort of techniques that we've, come about over many years of practice to support your work and other researchers' work. I guess is what's, this is how we've ended up where we are now.
Yeah.
Our next question, how did the PCIE Forum help bring you two together and this project about? Well, how did you come to the forum? You were there when I arrived.
Yeah. So I've been attending the forum for a little bit of a while, not too long, and that came to me via the NIHR ARC, the Applied Research Collaboration. So I was sort of invited to join that, and that was great because I was introduced to a whole set of really interesting people and organisations. So I'd attended the forum for a while, and I think there was a sort of light bulb moment. That sounds really dramatic, Paul, but in retrospect, I think it was. That you did a presentation, I think, for the PPIE Forum about Made by Mortals, a sort of PowerPoint thing, didn't you? And you talked about Made by Mortals and what it did. And I do remember thinking, that's interesting, because that sort of dovetails with a lot of things I've been thinking about making research engagement with the public and with people with lived experience a little bit more engaging than is the traditional route, which is we consult people, we take their views, and then we sort of go away a little bit and they get a little bit lost. They're not really still part of it, I don't think.
Yeah.
Which is not what I ever intended to do, but that seems to be what happens in busy research projects, I think. So you presented something, and I was already preparing this data application project that we've discussed, this social care data project for funding as you were talking. And I just thought, this is like, it may be fate. This is somebody talking about an organisation that sounds like just the thing I was thinking of, in terms of, like you mentioned, Paul, at the beginning, presenting a data-hungry project, because it's about data, and presenting it in a way that's less staid and less boring, than, because data and analysis can be a little bit boring to describe. And it sort of would bring the research to life, which is one of your taglines, I think, Made by Mortals.
Absolutely.
And I thought, well, this would bring the research to life. So I approached you, I think, after that presentation, and you were quite receptive, shall we say?
Yeah, absolutely. I was really excited.
It's probably helped that you're called Paul too. I'm Paul, and that I think we probably like each other, maybe.
We do.
But you must say that. You must agree or disagree with that.
We never met in person. Never. I've never actually seen you in real life.
Yeah.
Yeah, the forum has been great for that, hasn't it? In building those connections. I mean, I felt into it with Nikki Timmis inviting me to a co-production event. And yeah, absolutely. Just finding people who have, and I think that's what it's all about, finding people, allies in different areas. Arts and culture is one area that we work in, but with the health and social care thing, you find so many allies, people who are sort of committed to co-production, committed to using people's lived experience and imaginations and skills as part of a process. And I think finding people with those shared goals, and the forum is absolutely full of them, is really, really important. I can't wait to get my teeth into, or our teeth into your project, and start thinking about how we can use some of our methodologies to bring the data alive for people, because I think it's so important. And what we really try and do with the work is make it experiential, make it something that people can get right inside and immerse themselves in, using music, using the voices of people with lived experience, using drama techniques, using story and narrative and sounds, all to sort of, you know, move people into a place where, you know, they can really connect with something and sort of understand something on a more human level. And I think with data, that human story is what's really important. That's what connects people. That impact that data can have. That's 10 minutes, by the way. The impact that data can have on the person's life and health and family and all the rest of it. That's what I really like to bring across with what we're doing together. And I guess that's our role. And what I'm really excited about, Paul, is that other bit, because that's the dissemination, isn't it? That's how we're going to get those findings to the public. That's how we're going to get those findings to the practitioners. So that all the hard work that you guys have put in becomes as relevant as possible to people's practice and lives.
Yeah, we bring the research to life and we engage with practitioners, policymakers as well. We've got some links with social care policymakers. We bring it to life for them as well by kind of explaining that this is a data hungry project, but it means something to people's lives, because the whole purpose of the project is to look at, can we predict how well people might do with certain types of help? And certain people, will they do better than other people if they've got the help and other people haven't got the help? And policymakers and local authority people want to know that, but just to present a report with loads of data and analysis doesn't really give them a message about what should we do now with all that.
Almost,
an event or a interactive event and a filmed interactive event, etc., like you do, gives them another window into it, doesn't it? And that's the whole purpose of what we're trying to do, I think.
And I think we can share that with the forum as well. We can get forum members along to see what we've created together, and what the people we've co-produced the work with have created. So we can share that learning back with the forum, and that's one of the good things about it, I think, is the platform to be able to share the learning and experiences with. So, and I'm very excited from learning from you as well, Paul. This will be my first. I'll be a named investigator on this bid, which I've never had before. So I'm really looking forward to learning more about public patient involvement engagement process and learning about how we can support communities to get involved in research, and what I'm interested in is seeing where we can add creativity and use some of the creative methodologies we work at other areas in the research as well. So it's going to be a really great learning opportunity, I think, for me, for Made by Mortals, and hopefully everyone involved.
And for me too. I'm learning too.
Which is great. I think that's it. Well, the one question we haven't really asked is, like, what's next for us? Do you want to?
Yeah, we can go on to that, can't we? Because we've explained the other questions, I think, which hopefully will help our audience. Well, what's next for the two Pauls? It's like the two Ronnies, isn't it? What's next for the two Pauls? We're already talking about, I think, and I will say this, we're already talking about perhaps collaborating on another project, which is really to develop and evaluate an assessment technology. So assessments that practitioners, like health practitioners, nurses, doctors, and social care people, social workers, undertake with people to gather this information about, what do you need, what help have you got already, what do you value, what do you want to achieve by engaging with services. So we call those assessments in the professional language. And we're looking to develop a research application, aren't we, Paul, to look at a new assessment technology for older people across many different settings this time, not just social care, but primary care, for example, older people's mental health services, NHS services. And we're going to be partnering with that, hopefully, that's the intention anyway, with an international partnership. But which about that for now. We'll just keep that under our hats for now, and nobody will know. Nobody's listening. So
Yeah, and that's great. And it's what I really love is, you know, we support a whole group, you know, groups of people that come to us on a regular basis to take part in our work. And many of the issues that you're talking about there, and the work that you're doing, Paul, really do affect the community of people that create the work. And I think that's really important, that we can be involved with research and practice and strategy and policy that affect the people that we support. So I'm really, really excited about the future and what we can make together.
So am I. So we're kind of maybe planning to be stuck with each other for a little while.
For a little while, yeah. Anyway,
we'll see what happens.
All right. So what do they say at the end of the two Ronnies? It's good night from me, and it's good night from him.
It's good night from him.
It's good night from me.
It's good night from him, folks. Thank you very much.
Thank you.
Thank you.